Welcome to the Concierge Medical Marketing Podcast, the show dedicated to helping concierge medical practices grow and thrive. Hosted by Stephen Schwartz, a digital marketing expert with over 25 years of experience and a passion for improving American healthcare by helping concierge medical physicians succeed. Here's Stephen Schwartz.
Hello and welcome to the Concierge Medical Marketing Podcast. I'm your host, Steve Schwartz, and today it's truly my pleasure to welcome Dr. Chad Levitt as my guest. Chad is the one of the owner partners of OnCare Specialty Consultants, Care Beyond Treatment. Chad, thank you for being with me today.
Happy to. Thanks for having me, Steve.
Yeah, totally. So great to get to know you. I was at the Concierge Medical Forum in Cumming, Georgia in October, and I met one of your team members and started chatting and said, boy, I'd really like to have you on my podcast. And she said, oh my gosh, you have to have Dr. Chad on. He would love this. And I'm like, okay. So I'm glad that we finally got connected through LinkedIn and whatnot, and as a way of being able to interview you today and tell your really fascinating story about how your medical journey is taken to where you are today with a thriving virtual oncology advocacy practice. So let's just dive right into this. Please tell us, kind of where you grew up and what made you think about medicine and kind of where it led us to today.
Absolutely. Thank you. So I'm a Atlanta, Georgia native, multi-generational, where my grandparents are from here, and it's a little bit rare nowadays to still be here. My father was a pediatric dentist. I grew up sort of in a healthcare-ish environment, but always knew I wanted to go to medical school. I went to the University of Texas and then at Emory University, where I studied extensive liberal arts and got a degree in existential philosophy and creative writing and really a Renaissance type humanistic background. Knowing I was going to go to medical school, really I had an intention to be a craniofacial reconstructive surgeon to help patients and kids with, congenital anatomic changes or plastic type of surgical needs, based upon my father's, profession in this anatomy. And so I went to medical school at Emory University and was intent on being a surgeon. And then kind of late in my training, I was doing a big surgery with a head and neck surgeon who looked at me as he was getting ready to retire and said, if I could do this all over again, I'd be a radiation oncologist. He goes, those guys really cure cancer and they're helping lots of patients. And, I kind of shrugged it off initially, but about 2 weeks later, another person in the same kind of position said almost the same thing to me. And so I said, I need to pay attention to the messaging around me and at least do some diligence. So I figured out what radiation oncology was because it's a very small specialty. Not a lot of people even knew about it at the time. And it just checked off so many boxes for me, dealing with patients that were facing a real serious diagnosis and contemplating life and death type of issues as opposed to earaches and the sniffles, which are important, but it wasn't as fulfilling to me with my background of wanting to connect with people and to discuss the human condition, the frailty of life, and how we can make the biggest impacts. It also was a very technologically dependent field and lots of science. And I'm wired to approach problems that don't have an obvious solution. And I find a lot of fulfillment personally in being creative and helping others with complex problems. So I ended up becoming a radiation oncologist, finished my training in 2004, moved to Colorado with my wife where I practiced in a large oncology group for a number of years. And eventually, as we wanted to have our children, we decided to move back to Atlanta where our families were. And in 2008, we moved back here where I started my own oncology practice, ran a big hospital system, moved to another hospital system, and ultimately spent 23 years practicing oncology and all different forms. I had run clinical trials, big departments, small departments, and become an expert in insurance and coding and all the logistics that surround a cancer journey for a patient. About 2 years ago, as I saw the corporatization of medicine, becoming more of the common landscape for patients and cancer treatments, I just knew there was more that I could be doing for patients if I had a bit more bandwidth. And patients often express, in addition to the fear and anxiety associated with the cancer diagnosis, they don't understand the terminology of a lot of doctors' language. They're scared. They don't know how to prioritize their anxieties. They don't know how to navigate these systems. They don't know how to be an informed consumer of healthcare. And so we launched OnCare Specialty Consultants. We've actually evolved the name recently to OnCare MD, just from a branding point of view, keep
Good
it a little
move.
simpler.
Good move.
And focusing on the fact that we are experienced oncologists who have a mission to help patients advocate for themselves through education. So we meet patients where they are in their own mental space, background, interest, disease at any point in the cancer journey. And we really help them co-pilot or act as like an air traffic controller to make sure all the teams and all the involved healthcare professionals and providers of care are speaking to each other, are explaining to the patients all of their options, understanding the pros and cons, the risks and benefits of those options, and trying to help put the patient back in the driver's seat of their own journey so they feel engaged and can really focus on healing and living, and let us shoulder the anxiety of the logistics and insurance and questions and speak in layman's terms so that the patients can interact with their treating doctors and their treating doctors teams to advocate for themselves. On occasion, we'll get involved as a liaison to those treating doctors, which ultimately helps the treating doctors take better care of their patients, because our patients always come in far better informed about their own disease, their own options, their own risks and benefits and statistics if they want, than almost any other patient that a normal oncologist or a surgeon or radiation doctor sees. And so we help patients make more efficient use of their time with their treating doctors. We help them feel more confident in their own decisions, and we help them feel more confident in what questions to ask, when to ask them, how to ask them, and that does translate to just a better overall experience, if not better outcomes, and kind of just putting the patient back in the decision making capacity. I often say, the patients are the captain of the ship, but they didn't necessarily learn how to sail the ship, and they need a crew that is working like a well-oiled machine to take the best care of them. So that's where we developed about 2 years ago our model that's been evolving. We're direct to patients. We are really the only participant in the medical team for that patient that's not incentivized by anything other than just helping that patient in their specific needed manner navigate their own unique journey, and not feeling as if they're sort of along for the ride and just have to accept whatever treatment option is being presented to them.
Thank you for sharing all that. There's so many nuggets that we could pull from. And what I'd like to have you explain how your patients engage your practice, your time. And, with your practice, is it just you? Do you have other physicians who are virtually supporting your patients? Tell us about
Sure.
how your practice looks.
Sure. So it's been an organic growth. I started it completely on my own. I had intentions initially of providing like house calls in major metropolitan areas where we would sit down at the patient's own convenience with their family members and whoever else they wanted to be involved in their discussions. But ultimately, coming out of COVID, people were quite conditioned to telemedicine and the use of technology and virtual discussions and meetings. And not many people wanted to wait to schedule a time and a place. And so we adopted a virtual model. We've grown slowly at the advice of many people in the entrepreneurial space, which is the part that I'm not the best expert on, but have gotten quite educated on and excited about with this practice. So we do have a business operations administrative team that consists of a couple people. We have a little bit of a marketing person, and then we have a team of oncology advisors right now that help us with whatever specialty or expertise that we might need for each individual patient. But the reality is most doctors, whether they work for a hospital, whether they work for a private practice, whether they work for a community setting or one of the tertiary care facilities, meaning like the high-level cancer centers around the country and world, most of them are very willing to discuss complicated disease states and treatments with other doctors and with patients if they think they can help. The hurdles are patients not knowing how to navigate that, not knowing how to ask the right questions, not knowing what questions to even contemplate. So being experienced oncologists, we live and breathe that space and are quite comfortable in it and are able to help patients engage in whatever manner possible, be it second opinions other places. We can provide second opinions. We can we're there with them at any point in the journey. We do set a lot of touch points up where along their journey of treatment, with every doctor's visit, every lab value, every imaging test, we reach out to them a couple days beforehand and help arm them or equip them with the right questions that we're trying to answer so they understand why we're doing this or if we even need to. And then afterwards, we debrief with them and make sure that whatever strategic plan we had set up at the beginning is executed without any hiccups or miscommunications. The way patients engage with us right now, it's been a lot of word of mouth. Some patients come to us from the concierge primary care docs who want to extend the kind of care that they provide to their patients in the cancer journey. Because the reality of the traditional experience is that your primary care doc is great for blood pressure and heart attacks and diabetes and endocrine and things, but cancer treatments and oncology is almost like a whole different world of medicine. And when a patient gets a cancer diagnosis, oftentimes the primary care doctor and team have no idea what's happening. Everyone takes over from the oncologist's point of view, and the primary care doc might be left out of the loop. And that can leave gaps in what the patient's used to is having access to their doctor to answer questions and to make them feel heard and understood, as well as paying attention to all the details. So we seek to continue that continuity into the cancer space so that the patient continues to be engaged in their own care. So patients reach out to us. One of the very first things that we do after we explain to them our model, that we're here to help navigate and advocate and educate throughout the entire process, is we collect all their medical records. We house them with military encryption and HIPAA compliance so that they're untethered from a hospital system, which is often difficult to get all of the information from. We then review them with a fine-tooth comb rather quickly. We can often get all the records within 24 to 36 hours on behalf of the patient. We review them to make sure all the I's are dotted, the T's are crossed. There's nothing about the diagnostic workup that should or needs to be added. because once you start treating a patient, you kind of destroy the breadcrumb trail of the evidence to say, well, what exactly we were looking at. And in today's world, where there's so much exciting innovation happening in the science of cancer, not everybody is doing all of the necessary information gathering on the front side that they could. And you don't want to rush just straight to treatment and then wish you had more information ahead of time. We then have a long strategic planning session with each patient, with them, and after hours, over holidays, over the weekends, whatever's convenient for them, where we develop a strategic plan where we discuss with the patients not only the options offered by their hospital that they're at or their doctor, but all the standard of care options that are available in the U.S. Or other places even. And then we educate them on what those options are, what the risks are, what the benefits are, the pros and cons, so they can come up with, okay, what sounds good to them, as opposed to just what one system delivers. And then the easy part is, to be honest, delivering the treatments today. We help them, if they don't already find great doctors who are listening to them and are at the top of their game, and, don't just see one lung cancer a month. They see 10 or 20, and it makes a difference in the expertise and the treatment delivery. So while coming up with a second opinion and a strategic plan is seemingly a great service, we found that the actual execution of that plan along the journey for months and years that come after the diagnosis is where a lot of mistakes, miscommunications, mishaps happen. And so we have an annual membership where we develop that plan at the beginning. We develop contingency plans. We're available at any time to look at new innovations, new developments. We're always keeping an eye on clinical trials around the country that might be relevant to patients, either during their treatment, after their treatment, in the future as they develop. We also bridge a little bit with complementary care, the less traditional treatments that we can at least help patients do diligence on and educate them on whether or not this is safe, appropriate, worth considering, not worth considering. And we create a real integrative oncology model that focuses not only on fighting the disease, but on strengthening the patient's overall health, immune system, and wellness. For a long time, I felt strongly that even when bad things happen, like a cancer diagnosis, at some point in many people's journeys or lives, there does seem to be some meaning that can be gleaned from it in a beneficial way, whether it's years or months after their diagnosis. We always hope that a patient can live a better, more meaningful, fulfilled, enjoyable, healthy life, perhaps as a result of the cancer diagnosis or the journey. And the more we can kind of focus on that silver lining when appropriate, the better.
So I love it. So sometimes the positive lifestyle, diet, exercise habits change because of a cancer diagnosis, and through working with you and your team, as well as their local cancer team, we get the immediate problem, in most cases handled, resolved, and into remission. And then going forward, let's eat less junk food, let's exercise more, let's drink more water, let's get better sleep. I also love how you mentioned your practice works with other concierge practices, because that's what their patients are looking for and used to with their own primary care concierge doctor. And for that practice to play nicely in the sandbox with you, and you with them, and with everybody, with the cancer providing companies and practices in their area, everybody is working together for the best outcome for that patient. I love it.
Yeah, I mean, as we grow, we are bringing on more doctors. We have patients all over the country, as I mentioned. every patient's journey is different. So, we don't do pediatric cancers. That's a little bit more unique and outside of my team's expertise and my expertise. But in the adult cancer solid tumor diagnosis, we always are trying to make sure that when a patient contacts us, we always have like a 15 to 20 minute free consultation period to see, is this a good fit? Is there some opportunity here for us to help you? And I'm very honest. I don't want to waste people's time or money or energy on something that we're not going to be impactful with. And in order to maintain the concierge kind of approach, and I'm a little hesitant to use that term because concierge is that term, that semantic is evolving. To some doctors, concierge just means, someone pays you more to like answer your cell phone. That's not really us. I purposely do not build this practice on my own Rolodex. I want this is a scalable need that we've created and innovated this model for. And I wanted to, I set out as a mission to create something that would, succeed me and I could be proud of on a larger scale. And so every patient's coming at it from a different point of view, different life experience, different disease state. And it really needs to just have the bandwidth to offer each of those patients what it is that feels right to them. It really is like changing up the common patient's idea of healthcare in saying, look, you deserve and should approach healthcare as an informed consumer. And you should be able to do the diligence just like you would if you were buying a new car or buying a new TV or a gaming system or a pair of shoes. You're gonna compare prices. You're gonna compare stores, experience, customer service, all those things. And because healthcare traditionally has felt like something different, as it's become institutionalized, more like a corporation, or they are corporations that deliver healthcare now, the patient feels like they shouldn't be able to expect that same sort of experience or customer service. And by educating them with the bullet points on what they're trying to ask to their treatment team or explore, we help them keep it simple and efficient so that they can get the right answers from their team. And that's beyond just the information overload that they get from their friends and family and media and every which direction. So when a patient who's working with us, reads about a new paper or something new on the TV that sounds relevant, they can call, text, email us, and quickly we're able to get on the phone with them and explore that, option. There's very few things that are relevant and meaningful and helpful that we don't already have expertise in, but we can do deep dives into really anything so that they can say to their friends and family, I appreciate that your aunt had the same thing on paper that I do and did this and this and this, but, and I'm glad you brought it to my attention, but my journey is a little bit different where I explored that and I'm not going to worry about that not being part of my treatment. Or I'm glad you brought it to our attention. And when I brought it up to my doctor at the hospital, they were excited that I knew about that. And now we've implemented it in. And I'm happy and passionate that, we're able to utilize said treatment or intervention.
Right. Everybody's story and their journey is a little bit different. And, we're bombarded with medical ads on the television where all of the side effects sound so awful that it's like, well, gosh, I don't want to try that. But ask your doctor about so-and-so. I asked my doctor about it. He said, Steve, you don't have a uterus, so don't worry about that one.
Exactly.
I'm kidding. Back to the business structure. I love the fact that your practice is virtual. You are there as an advocate, as an extra team member on your patient's bigger team to help prep them, explain things, answer questions and whatnot, playing nicely in the sandbox with their team on the ground in their area, which is fantastic. But I'm a business guy, and I love how your practice has the ability to bring on more cancer specialists to work with your team to be advocates for your patients.
Yeah.
And furthermore, you as a company have the ability to scale with different concierge practices around the country in a friendly partnership type of arrangement, so that as they have patients who have starting a cancer journey, they can say, look, you want extra help and hand holding through this thing? I have got the company, the practice that will help you through this along with us and your team. We're going to work this together. So as a business, you're in a really good position to, first of all, you've shown over the last 2 years with about 100 patients that it works, and you're getting great results, and it's helping your patients with their peace of mind and success with their treatment. And then furthermore, you have developed this pattern, this model that you literally could expand quite easily as you bring aboard, again, more doctors to do the advice, more partners to refer, and then any folks obviously that you want to do is just sort of consumer to your practice. That works as well. And the arm of my company that does marketing is Concierge Medical Marketing, and we offer 3 different programs for our clients to help them wherever they are in their business growth and success journey. And I just want to rattle through these quickly for our listeners' benefit. Number 1 is a transition. So in the program transition, let's say a physician has a practice with 3,000 or so patients, and they're tired of seeing 40 patients a day and struggling with insurance paperwork. If they're transitioning to a concierge or DPC type of clinic, then we can help transition some of those existing patients over to get to their desired panel size. Number 2 program that we offer is called Growth. And that's where an existing practice wants to grow. Maybe they have 10 or 20 or 50 or 100 patients. They want to get to 250 or 350 or whatever it might be. We have different methods of digital marketing to help achieve the outreach, the growth, the education, and whatnot, the automations, to help bring in a steady supply of new patients to that practice to get to where they want to reach. And then third and final, we call nurture. And we all understand that when we get to a level in a practice, maybe we don't want to grow anymore. Maybe 300 is the magic number. We're good. We have a wait list. We don't need marketing to grow. What we do need is to nurture. We want to email our patients and keep them abreast of what's going on in health and what's going around people are getting sick with right now, or all the discussion of vaccines or whatever it might be. We want to stay in touch with our patients and nurture them and keep them happy, so that what we do with marketing in concert with the amazing care that our clients are providing to them, they renew their membership in their concierge practice every year. Right? It's always easier to keep a happy client happy than having to find a new one. So those are the 3 things that we offer through Concierge Medical Marketing. I've written a book called The Definitive Guide to Winning with Digital Marketing for Concierge Medical Practices. And the book's over 100 pages, tons and tons of actionable information on there. And the book is totally free. It's available through downloading from our website, conciergemd.marketing. Simply go to the homepage, scroll down till you see a picture of the book, put in your email address and hit submit, and our system will email you with a link where you can download the PDF. Please read it, take it with my compliments. If you have any questions whatsoever on the book or the content, or need a little extra help or hand-holding, that's why I'm here. Happy to do a strategy session with you, one-on-one, no charge. And our phone number is 772-304-2420. So I just through our podcast, through my book, through the webinars that we host, we want to give away tons and tons of great information that can help physicians to grow their practices to the level they want, to achieve the lifestyle and the income they want, and to get the best patient success afterwards. So we're thrilled to be a part of this journey from our own little corner of digital marketing.
On that note, we do also, on a similar thread, offer to concierge practices. We're quite humble. We're not looking to overshadow any great relationship between a care provider and their patient. We actually offer to concierge practices the ability for us to exist as like an extension of their care model without it being our brand. I do offer to concierge doctors because it is an extension of their tone of service, the ability for them to say, oh, we also have an oncology arm to our practice, and we work with practices, to give discounted rates to their clients. So there is a collaborative, synergistic partnership as well. And just from that place, there's so many exciting opportunities and innovations happening in both of the general concierge space as well as in our oncology space. On that, from the technology side, people are often hearing about the benefits of AI and all the new technologies on the molecular and testing side for figuring out what kind of cancer you have, not just what kind of cancer, but what kind of breast cancer specifically you have, because there's probably 50 different kinds. And at some point, not far down the road, we're going to be talking about cancers not as breast cancer or lung cancer or prostate cancer. It's a big molecular spectrum. So a lot of doctors you might hear say, well, I'm worried about AI or technology replacing doctors. That's not what's going to happen. I don't believe. I believe what's going to happen is doctors who are familiar with the language and landscape of technology are going to replace doctors who are not able to harness those things. And as a result, we do harness technology extensively. It's helping patients live longer, have higher cure rates, have better experiences. And so we harness a lot of that as part of our model, but we recognize that ultimately the human doctor who's experienced with decades of oncology care, as well as all the nuances to the current landscape, as well as all the new technologies that are happening rapidly in an exponentially growing manner, still benefit from having a human interface for the patient to understand what the meaning of these new innovations and technologies and results are. So it's an exciting time for a lot of reasons. It's also a bit of a scary time because there needs to be chaperoning of these technologies. And there also needs to be additional services provided for the individual patient so as not to get lost in what's becoming a bit of a fragmented care system of treatment delivery. You go from with a cancer diagnosis, you often need a surgeon, a chemotherapy doctor called a medical oncologist. Sometimes you need a radiation oncologist. Sometimes you need a pathologist, a radiologist. You also need specialists in general medicine to help with side effects from cardiology to endocrinology to primary care. And it's a lot of moving parts. And the reality is healthcare is not really that different than any big corporation in this world today. And the delivery of care is the product. And the patient can get lost in that if there isn't someone advocating and helping them feel like that. So by being direct to patient, by not taking insurance, we had to make it a cash model membership to be untethered from biased incentives. But it allows us to be very flexible and mobile and malleable and putting the patient at the center of every decision and every conversation. And patients often come to that realization that the doctor works for the corporation and takes care of the patient on behalf of that company or on behalf of that hospital or on behalf of that healthcare system, which is a little discouraging and alarming to actually say out loud because most of us doctors don't go into medicine to do anything other than to help others in an altruistic manner, in a selfless manner. And when you hear about doctors struggling and being spread thin and overworked and anxious or upset, it's just because the expectations of what they started out in medicine to do haven't changed, but the landscape of medicine has. And customers, patients, I don't call anyone a customer, but for the sake of this conversation, that's kind of an appropriate term. Deserve to understand that they can be an informed consumer, and they should be. And but it's hard, and it's hard to know that someone like our practice exists. But I've just gotten more and more enthused by how many patients we've been able to help, how many common, simple mistakes we've helped prevent just by having the bandwidth with a limited number of patients to spend the time that I think most employed doctors, either be it employment from a practice or a hospital system, wish they had. I mean, from a cancer diagnosis, the reality is what we call the workup, which is doing all the tests to figure out what's the stage of the cancer, what kind of cancer is it, what are the molecular variables that are unique to this tumor through a biopsy and pathology. That's a very heavy workload to do correctly, and it's time consuming and it's arduous, and it's not necessarily that profitable for a system. Then sitting down with that's sort of the way I think about the first step in a cancer journey, is the workup and the diagnostic process. Secondly, the informed consent process, which is saying this patient is aware of all the options out there and they understand the pros and cons of each option, and they've agreed to go down this pathway for treatment. Oftentimes that's a form that gets signed very quickly right before the treatment begins. But that is arguably one of the most important portions of the cancer journey. And it's very time consuming to also be a good listener, be a good communicator, be experienced enough to understand that you could have the same exact diagnosis in two separate patients in front of you, and each patient choose a totally different treatment option for themselves, and it'd be the right one for both of them. But you have to be wired in a way to hear that and to help navigate that patient. And again, that's not profitable for a company either. What's profitable is the third phase of a cancer journey, which is just the treatment. And while you need to be experienced and good and competent and well-trained, today the treatment delivery is arguably one of the easiest steps in that whole process, and definitely the most profitable. So to expect that the average doctor seeing hundreds and hundreds of patients each year has the bandwidth and time amongst all their other duties as an employee or a partner in a group that also is for profit on some level, can do all of those things very well, it's not really even that realistic. So we seek to help fill those gaps wherever they might lie in each individual's journey. And it really alarmingly has become very necessary. And we're just seeing, this growing, hopefully more and more so, and becoming more of the norm that a patient expects, as opposed to a disrupting, outlying perspective.
Well, you're definitely found a niche, you're filling it, and you didn't realize that this was an area that people truly needed. And it's being proved that it is needed because you're growing so fast and things are going so well. I have really enjoyed this conversation, and we have to wrap up, unfortunately. So, Chad, if a physician is listening to this podcast and has an experience in cancer, oncology, and loves what you're talking about doing, or a different DPC or concierge practice wants to partner with you, getting preferred rates so you can help their patients through the journey, how can these folks contact you and start those dialogues?
Sure. So our current practice model is called OnCare MD. Our website is onc.care, so www.onc.care. They could contact my team directly by text or phone at 770-299-9793. They can go to our website. We are very efficient in getting back to people. We communicate with patients and teams all the time. So whatever format is easiest for them, we can set up video calls, we can set up phone calls, we can discuss things on email. And since we are non-regionally limited, meaning we are across the country for for most major areas. We are always seeking to build relationships and network so we understand those geographic landscapes that perhaps might be a bit more unique to traffic patterns, hospital systems, treatment modalities, and things like that. So we really appreciate your work and the opportunity to discuss what we're doing, and we look forward to collaborating on the future needs and both for providers as well as for patients in whatever manner seems easiest and most beneficial.
Yeah, I appreciate that. Yeah, I am looking forward to working with you to expand the message of what you're doing to physicians all across the country, as well as the patients, so that you can have leads coming in from different sources and methods. And literally, you're elevating healthcare. You really are. So, Dr. Chad Levitt, thank you so much for your time, sharing your passion, sharing your stories. I'm so grateful for you taking the time and glad to get to know you. This has been the Concierge Medical Marketing Podcast. I'm your host, Steve Schwartz, and thank you for joining us today. We look forward to having you along on our next episodes. Take care, everybody.
Thank you, Stephen.
Thank you for tuning in to the Concierge Medical Marketing Podcast. Please subscribe and leave a review wherever you listen to podcasts, and stay connected with us on social media. To speak with Stephen Schwartz about growing your concierge medical practice, give him a call at
772-304-2420
or visit our website at conciergemd.marketing. We will see you next time.